Welcome. My name is Evan Steele. I'm CEO of RATER8, and today I'm going to present something which is called Patient Perception is Reality. But before I start, just a little background about me. I'll take about 60 seconds and then we'll go right into this webinar. Please keep in mind that you're able to raise your hand. If you look at the bottom of your panel, the screen that you see, you could raise your hand if you have a question, or to just click the Q&A button, and I'll be sure to answer questions. We could stop at different intervals, or at the end we could have a Q&A session. And feel free to ask any questions that come to mind. So I've been in the healthcare business for a very long time. Hold on, I'm getting echo. You gotta. Sorry about that. I've been in the healthcare business for a very long time. When I graduated business school way back in the 90s, I actually went into Wall Street and worked as a banker. I didn't like that industry and ended up working with my brother, who is a ophthalmologist in New York City. And he would see patients and I ran his practice. So I ran his practice for many years, but we found out we had a massive problem with paper charts. Multiple offices, paper charts all over the place. These are the early days of EHR, and we actually went ahead and built our own EHR, which we then sold. And by the time I sold this company called SRS in 2012, we had about 5,000 doctors on the platform using software basically to be more efficient and have paperless offices. So in between SRS, the EHR company, and starting RATER8, my wife and I were traveling. My wife's sitting right across from me because we work at home. And she and I were checking into a hotel. We were in Prague, actually. We're traveling to Prague. It was a name brand hotel. And we go to check in, and we had a really bad check-in experience. And the check-in person's name was Federico, and we remember him by name. There was no good way of complaining about Federico. We didn't want to bring the manager out and complain about him right in front of his manager. That would have made us uneasy. We did get a survey a couple of days later, and it was from the hotel chain, and it was like 60 questions long. And I looked through the survey. There was no mention of Federico. So that's when I decided I'm going to change this. I want people to be able to give feedback about specific individuals that they encounter, whether it's a hotel or a restaurant, or, given my medical background, of course, where we focus on and only focus is the medical office. So there's John or Betty at the front desk checking you in, giving you that experience. There's the nurses, the technicians, the doctors, the checkout staff, there's billing staff. It's all those people, the perception that's created by treating your patients directly by interactions they have directly with people. So RATER8 has a reputation management. We could build online reviews component, but really the first core feature was the ability for patients to give feedback about their doctors and the staff members, individual names, in real time. So as if I was in the hotel, I'd like to be in the elevator on the way to my room, and I have that survey. Same thing. So we like to interface with the EMR, the practice management system. As soon as the patient's marked as checked out, survey is sent, and that patient could give that immediate feedback. We're big believers in perception is reality. There's two parts to perception is reality, and one ties into why we're here today. We're working now with, from a malpractice standpoint. I think you'll find interesting, if no one's read this book, I read this years ago when it came out, and I always remember this book. And in fact, when we were talking about this webinar, this book it was top of mind. When you think of reducing malpractice lawsuits, Malcolm Gladwell wrote a book called Blink, and in it he says that, I'll just read here, a patient's likelihood to file a malpractice lawsuit correlates with how the patient was treated by his or her doctor on a personal level. And right, so they looked at hundreds of conversations and recorded hundreds of conversations, which were patient interactions between the doctor and the patient. I guess they got permission from a HIPAA standpoint, and then they looked at which of these they looked at the patient interactions and kind of graded them. Like the doctor was attentive and paid a lot of attention and did a good job in addressing the patient's concerns and taking the time to answer their questions. And then the other set of doctors who were more more short with the patient and didn't have that real good bedside manner. And they found, and then so they compared the the level of interaction, in how the patient was treated, good or bad, with the number of lawsuits that the doctors had filed against them over their careers. And they found that the doctors who weren't so nice and so good with their bedside manner and listening to the patient were sued more. And they weren't necessarily worse doctors, right? They controlled for that. It was really, when a patient has a good experience with a doctor, certainly a litigious one who has a baseless lawsuit, they're much less likely to sue a doctor who they like, right? Well, I'm not going to file a suit on this doctor who has, for a baseless claim. But even claims that had some merit, the patients were less likely to sue if they've had that positive experience with a doctor. And I would extend it. That was the research in the book. I would extend it. It's not just the doctor, right? It's from the time I pick up the phone and I make an appointment and I come in, we call it the art of the warm welcome, right? I come in. How am I treated by the staff? How am I greeted? How do they make me feel? How does the nurse make me feel? How does the doctor make me feel? And then when I leave, how's the checkout? How's my billing experience? How is it getting refill our prescriptions? Like all those workflows and those people interactions go into this patient perception, right? So a lot of what we do here at RATER8, and we could show you some things, is get that feedback. And also, once you get the feedback, if you identify an unhappy patient, there's a huge difference is when you call that patient up and say, "I'm sorry, you're unhappy. What can we do to rectify it?" And if you don't make that call, again, no research here, but you would assume that if you call a patient, smooth things over if they're upset, they're much less likely at some point in the future to want to be litigious with that practice. So that's perception is reality, right? And like we talked, same doctors, same level of care, but all this perception creates big differences in how the patients feel about the practice and what kind of care they're getting. So this is a key thing, and again, this is a patient's perspective webinar. So we want to get into the minds of the journey of the patient from the time that they decide they need to make an appointment till the time they're seen and then have completed the visit. So we'll start from this angle here because it's really where the patient journey starts, and that's this box right here. The journey starts here, brand awareness. I saw the attendee list. I see a number of practices are larger here. So, they certainly have large marketing budgets, but I think every practice has some sort of marketing budget, whether they have someone spend time, putting information up on the practice's Facebook page, and we could go back here. Social media, some of the large practices have billboards, there's print ads, there's sponsorships of local events. There's also word of mouth. Patients find you from insurance company directories, either a book or online, again, social media, and local search. Patients are searching for ABC doctor, type of doctor near me. So let's say urologist near me or family physician near me. Just like we would search, for like an Italian restaurant. I do it all the time. I want to find an Italian restaurant near me. I type it into Google and I get a list of restaurants that match that search. Patients do the same with medical offices, urologists near me. Once the patient, you've spent money on your brand awareness and your marketing, patients are going to go online for affirmation before they go book an appointment. So let's see what that process looks like, right? So remember, I'm right here. You spent all this money. I know the practice name now. It's at the tip of my tongue because I've seen your billboard ad 100 times, or I've seen your print ad, or I see you on Facebook. So now, let's say I need something. I'm going to go check online reviews. That's really the first thing we do. In fact, in 2017, the Wall Street Journal published an article. They summarized some research. I'm sure you guys are familiar with Pew, P-E-W, Pew Research. Pew Research said that 77% of patients, when looking for a new physician, will check online reviews first. That's a lot. That's more than 3 in 4 patients do that. So let's put ourselves into the mode of being a patient, and let's just do some searching. So Again, I need a family practitioner. Oh, I saw the billboard, Columbia Family Medical Group. So I type it, and this is what comes up, right? So naturally, I'm a patient. What's the first thing I'm looking at? The first thing I see is this. This is actually nice, a nice building, you know, map. They have good pictures here. You should see, literally, practices have a picture of the side of the building with a dumpster, and that's the image of the practice. So the first thing you want to do is focus on the Google listings because it's right here. And it's visible, and it's more visible than these search results here, right? The second thing I see is 3 stars, 26 Google reviews, and I'm thinking, something might be up with this practice, and the patient might click here and sort by lowest rating, and now I'm reading about all these nasty things the patient's saying. And 3 stars, I would have needed a 3-star Italian restaurant. I'm certainly not thinking I'm not going to go to a 3-star medical practice, right? So that's a break in the chain, right? You spend all this money, they get to check online reviews, and then you just broke the chain. The patient just stops. They're not going to click on the website. They're going to think of Premier Family Medical, that they also saw the billboard, and look up them and see if the reviews are better for them. So that's called a break in the chain. Here's an example of actually a client of ours in Wichita. They spend plenty of money on their marketing budget. Someone searches for advanced orthopedics, and they see 234 reviews, 4.7 stars. Good Facebook profile here. Health grades, 179 reviews, 4.7 stars. Some good stuff here. So okay, so now I've just passed this check, right? I spent all this money on marketing. Now I'm ready to go to the website. So I'll click on website, right? And that will bring me to the website. And so we're gonna go over what happens when you get to the website and how to get the patients to book the appointments, because a lot of practices have their websites some are really great and some are really bad, right? And have bad workflows that make it hard for the patient to get the information we need. And I'm going to show you some examples. But first, let's finish the patient searches, right? This is your branding search, right? Based on your marketing budget. The other type of searches are physician searches. These are very popular, and people are looking for physicians based on recommendations from a friend. The primary care physician gave them a few names, right? Even from a different practice. Patients get doctors' names from their Facebook. I know my wife, there's a local mommies group, right? She could just go on and say, hey, I need a dermatologist. Anybody know any? I get 3 names. Who do I use? So it used to be, when I got a list of 3 doctors from my primary care physician, and let's say I want to see a specialist, I would go to the first one on the list. If they had, this is going back before all these online reviews. I go on, I look on the list and pick the first doctor, and if they had an appointment that was convenient to me, I'd make the appointment. It's not like that anymore. So patients here will search for James Gluck in Wichita. So again, where does the eye go? It goes right here. I don't see a picture of him. It's not personal. I see a picture of a building. I see the same thing. Only 2 reviews, 3 stars. Let me look a little more. And I search down, and I have 3.8, not even 4 in WebMD. WebMD, by the way, acquired Vitals, and WebMD has been coming up higher and higher in organic search, just so you know. WebMD is becoming more and more important. It's not one of the review sites that people are typically familiar with, right? It's usually Google Health Grades Vitals, and Yelp's a whole nother story. But even on Vitals, 3.8 stars. So again, if I have a list of doctors, I'm like, James Gluck, you know what? Let me check out this Brennan Lucas. Here, this is also from our client, that orthopedic group. 66 reviews, 4.8 stars. Health grades, he's got 65, 4.7 stars. 600. Look at this. This is actually RATER8. We collect internal feedback and publish it. 641 reviews, 4.9 stars. Vitals. Great profile. Let me click the website and investigate this doctor. Here's this picture, right? Nice picture of the building. I'm comfortable now to at least go to the next step and get to the website, right? It's all about getting them to the website to book the appointment. So you can see the difference here between the two. One last type of search is that near me, the Italian restaurant near me search. Well, in this case, we have, I want a family medicine near Columbia, Missouri. And Google will give you, before you see anything else, look at this page. The only thing you see is their recommendations. There's other searches here, but this is all you see. Right? And I might add, these kind of searches where Google's on the right, on mobile, it's the only thing you see. All this other stuff is not even on the left side, it's below the fold. So that makes these Google profiles very important. So family medicine physician near Columbia, Missouri. And I don't see good choices here. I said, wow, 3 stars, who do I use? I'll go to the website, maybe I'll look at more places. Like, I'm not being drawn to clicking on these practices. There's a lot of factors, and we could talk about them if you want at the end, of what helps you get in this 3-pack and not in more places, which is like Google Siberia, right? It's like when you have to click on something to see more information. So we want to get you up here. You want to be up here, but here's an example of a family medical group in Murrieta, California, one of our clients, Rancho Family Medical Group, right? So you say family medicine near me, and you see 163, 4.9 stars. It's better than anything else here, even better than this competitor here that has good reviews. Let me go to the website and start that process. So this is what 77% of patients looking for new doctors are thinking, and this is exactly what they're doing. They're doing branded practice searches, doctor searches, and local searches for that type of practice. Any questions up to now? Feel free to click the Q&A button, ask some questions. I could either unmute you. Okay, no questions right now. So as promised, we've now passed this test. We said they're going to go to the website. And there's a lot of ways to get to the website. Google makes it real easy. There's the website button here. There's the website button. When I click here, I could click on the website button, or I could just go to the top link for the doctor. It brings me right to his bio page, right? So now that the patient's going to search, click, and I'm now on the website. So I found this one here, Columbia Orthopedic Group. I guess I picked a town kind of in the center of Missouri. I think they're in the center of Missouri. I don't know my Missouri geography as well, but so here's an orthopedic group, for example, and same thing for even family medicine. I might be looking for, or a big multi-specialty group. I might be looking for an allergist, or in urology, I might be looking for a doctor that deals with a certain type of procedure. In orthopedics, I might be looking for a hip doctor, because I'm looking for my mother who just fell down and fractured a hip. So now I need to look for a hip surgeon. This website doesn't have a way that I could find who the hip surgeons are at this practice, right? Usually there's something called services or procedures. I don't see it. Maybe it's buried somewhere, but I don't see an easy way of finding this out. Maybe it's under I'll click physicians. And it has a list of all the physicians, but they're not aggregated by type. So this makes it difficult for the patient looking for that, like, which doctor here does hip surgery? Do I have to look at every single one of these bios to figure out who does a hip surgery? So that's inconvenient. So here's a St. Louis orthopedic surgeons. They do a little bit better job. I could go service, patient info, actually. What's services, actually? Both do the same thing. Services, and I say hip. And now I have, I get information on the hip. Okay, we do hip. But notice there's a lot of information about the hip, but there's no, again, here's one, meet our providers. There's one, and it's rotating. It's doing one, and then another, and then another. Again, I just want a bunch of doctors that I could go and kind of investigate them, right? So the third one I'm going to give you, this is actually our client I keep bringing up, but they have a whole nice services tab. I could go to hip surgery. And here they list. I actually like having the pictures because I think visual is nice. So Amanda, if you're on the phone, I could show you one. Pinnacle, one of our other clients. I'll show you a nice, if I go over here, they have a nice thing here, hip, learn more. Here, so they have pictures. Pictures are nice, right? The picture tells 1,000 words. But this is good. I have the 5 doctors I could click, and now I could go learn more about the doctor. Think of what the patient has to go through if I don't have this simple list of 6 doctors. Out of all the doctors in the practice, these 6 doctors who do hip surgeries, I have to pick up the phone, call the practice, probably deal with a phone tree, find the right department. Maybe there's no button that says to find out which doctors do what. Click 3, right? It's probably the appointment line. And I'm talking to some person in the appointment in the call center and saying, who does hip surgery? Hopefully they have the list right in front of them. If not, they put me on hold. Then then they read off a bunch of names. I'm writing it down. Then I go to the website and I start searching because I want to know where the doctors went to school. I want to, where they trained. I want to see if they're fellowship trained, if it's a specialty, right? Board certifications, all that. So really, like this website, they're just making it difficult for patients to find that information. This website, they're making it easy, and the patient's more likely to land on one of these doctors' bio pages and read up about them, versus going to the next practice, another website that'll make it easier. And we all know this, guys, right? You go to like a shopping site, if it's just hard to find the product you want, you go to Amazon then, and you find it there. You might even have to pay a little more, but it's just easy, so you pay more. Okay, so that's a little bit about the patient journey to get to the website. Now, once I'm on the doctor's bio page, there's one more test you need to pass. So this is actually, my brother's a doctor, so this is his page. Yes, he's slightly better looking than me, and he's 5 years older, but what can you do? He's got the genes. So here's a bio page. It shows where he trained, right? It talks to his fellowship trained. And by the way, that's another issue practices have. Like, do you put all the doctors that do the same procedure, or do you put the fellowship trained ones that do hundreds of these procedures a year? Or do you bifurcate the list and just show the ones on top that are fellowship trained or not? So that's a political issue that you have to deal with internally. But don't not put the doctors who do it on this page. Just don't not do it, because you really got to think of the patient. So food for thought there. So they could read, oh, he's been listed in Best Doctor in New York and all this stuff. Great. I feel good. I saw the good reviews, nice website. Perhaps I'll make an appointment. And what they don't have on this page here, and I don't like, it says there's a contact us, but it would be really nice if they had used this empty space and said, call for appointments, had the number. I just call right up. I don't have to click anywhere else. So I'd say about 40, 50% of our clients' website make it really easy to just dial that number. And and it's very easy to do. It's just putting a number in the header here. So food for thought on that. But look at the difference between this page and this page. They're identical, except this page has these nice, you can see they shut down for 3 months from March, April, and May in New York City here. But this has a nice testimonials. And what we do is we go around to Health Grades, Vitals, Google, Facebook, and RATER8 itself, our own internal comments. And we look for comments that are 5 stars and are over 100 characters. Why over 100 characters? Well, great doc is not a testimonial grade comment. So here's all the testimonial grade comments. This one just meets the 100 character threshold. So there's testimonials. You could start reading, and make it easy for patients to read and get excited about the doctor. And also there's a badge here that goes to even more reviews that will show all the 229, here, I'll click it here, to the 229 comments, so that the patient can get a picture of the doctor and all the comments, unfiltered, good and bad. There's verified reviews, and they could look there. These are the best, right? That didn't make it to the testimonial grade one because it wasn't 100 characters, but it's just more information for the patient. So I ask you, if you're a patient and you made it really easy for them to get past the online reviews, get to the website, now get to the doctor's bio page, this page is nice. This page has more information for the patient, and I'm more likely to click on that appointment link. Okay. So that's a little bit about the patient journey. And now that we've passed all these little tests along the way, we make that appointment. And I think every one of you on the phone from this one we just talked about is probably going to look at their website, and there's probably a lot you guys could be doing. And small changes. These are not big changes. Small changes to book more appointments. Okay. The next part goes to the second half of this webinar. Just goes to the, our knitting, our DNA, RATER8, which is why we started the company. Is that practice improvement piece. So, we want to, the patient makes the appointment. We want to get feedback. We're all not perfect, especially larger practices have lots of employees and lots of patients and lots of offices. We actually find little small 1-2 doctor offices do better at customer service and have higher ratings than the large ones, right? Because they could give that more personal service. So you want something where you could get all this feedback and improve the patient experience. And then this, once you have happy patients, this to me is the most powerful marketing. You could spend $100,000 or $1 million on brand awareness and marketing, but if you're not going to delight patients and generate goodwill and positive word of mouth referrals, then all this stuff here, your online reputation and your ads, it's like lipstick on a pig. You try to make yourself look good online, but at the core, you want to generate word of mouth referrals. And what's the saying go? It's something like a happy patient tells a friend, an unhappy patient tells the world. So we want to make sure that patients are telling their friends to go to your practice, and that's the best kind of marketing. Okay. How is that done? There's a million survey companies in the world. I just say buy something that's going to do surveys, HIPAA compliant, send out surveys. I figure I'll show you RATER8 surveys. They're very simple. We like to interface with practice management systems. Remember my dream of being in the elevator at the hotel and I could trash Federico in that elevator and someone's going to read my comment. Well, same thing. We want to interface with the practice management software so that when the patient's marked as checked out and the patient is in the parking lot, if they're upset, they could vent. And better for them to vent on a little internal survey than to vent on Google, Vitals, Health Grades, on any of those online sites. Let's say I love this doctor, I hated him, it doesn't matter, I'll give the star rating, and then we get a survey, and I could change my rating. Let's say I felt a little rushed today. So we could put the comment. We have kind of interesting, this goes back to, again, our DNA, our knitting, our beginning is like we want to rate people and staff. So we actually built in the first version of RATER8 was we rate the doctor and a staff member. So if your practice management system tells us who the person who checked in the patient was, if you're not using a kiosk, let's say, then we could say rate Alex by name. If not, we could just do rate your front desk staff or staff friendliness. Okay, so Alex was great. You should see the comments we get about front desk staff. Alex was eating a burrito and checking her iPhone and chatting with our workmate when I walked in. You would never know this, but patients, especially with our surveys, which we say are anonymous, patients get very upfront with their feedback, and you read some interesting things. And then we have these questions. So let me just flip back here. We believe you should ask questions about all aspects of your practice. So here's, we have like 25 or 30. Here's 15 of the more popular ones. And these questions deal with everything from scheduling experience to the check-in experience to waiting room time and all the way out through the visit, the doctor, and the billing, right? You want to cover all areas of your operations and practice and people. What we do is notice that the question is the doctor, the staff, and then there's only 3 questions. And you're like, wait a minute, what do you mean 3 questions? We call these micro surveys. You could choose to ask every one of these questions, right? But we're only going to pick 3 of these, boom, 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 3 at random for the survey. So no patient will ever ask to answer more than 5 questions, the doctor, the staff, and 3 random questions. But 3 random questions means that by picking at random, over 100,000 surveys you send over a course of a year, you're going to get every question answered. We don't want the patient burnout, like that hotel, that hotel or airline survey you get, that 60, 70 questions. You fill it out once. If you ever get to the end, you'll never fill out another one again. So we need to keep surveys short. And we like to, waiting room time was okay, 30 minutes. Right, or let's say it was too long, 30 minutes. And we want to structure it so that every question has comments tied to it. So later on I'm not going to show you our dashboards, but on a dashboard, you could see all the comments that are associated with certain questions. That's kind of important too. Our COVID preparedness, which is the most interesting question that you'll ever see. The things patients say and observe in a practice is mind-blowing, about masks and pens that are in pen caddies, and they talk about check-in kiosks that aren't wiped down, and they talk about clipboards that aren't wiped down, and they talk about waiting rooms that are crowded, that the seats are too close together. Again, the voice of the patient. There's nothing better than listening to the perspective of a patient and seeing what they're saying and then acting on it, making those improvements. So let's say COVID experience was great. Everyone wearing masks. That's a big comment. That's like, that's in 19% of our COVID-19 response comments. We call it almost 1 in 5 patients mention the word mask. That's how important it is today for patients. So notice this patient is happy with a lot of aspects, but is unhappy with waiting room time. So the last key aspect, remember we said the survey is anonymous. If I click submit and we detect some unhappiness, it says, please share my name and email with a manager, right? So this gives the patient the opportunity to keep themselves private or share their name. And if they share their name here, then the good news is that somebody's going to reach out to them and fix the problem, which is unbelievable. You know, it's like when the manager comes out at the restaurant and apologizes for the bad experience, gives you a free dessert or something, and then all of a sudden your bad experience is turned into like, this restaurant's the best, they care about me. So service recovery is very important. And the last thing I'll just show you before we open it up to questions here is there are other modes here. You could have review builder mode. Patient gets a survey, they click on the 5 stars, and now it says instead of doing a whole survey, you could send the patient right to Google to post their feedback, and it pulls up the rating form, and the patient could just type in, you know, I just already pre-filled something and could type something in to post a review, which ties back to all this stuff, you know, just building up these profiles. So that ties up everything, right? You spend money on marketing, you get them here, new patients, then they give you feedback, you act on that, and then you generate those wonderful word of mouth referrals, and it's just a virtuous cycle of building up your practice, and why we're here today, and helping mitigate the incidence of malpractice lawsuit. That's the whole other benefit of that, which I think is very important as well. So I'm here to answer any questions. Feel free to stick around, but that's the end of my part of the webinar. Now it's all about you guys and answering any of your questions.
Hey, Evan, this is Josh. Got a couple questions for you. Well, maybe one just as a comment. First, I think you're just as handsome as your brother, so don't let that fool you. You know, one thing I had heard from, I think it might have been from Sam, you know, is that I've told my clients is, you know, one is to treat, you know, the first page of your Google as your business card, right? And I think a lot of the folks that are online right now probably have gone and checked their Google page, and if they would print that off, and would they feel comfortable handing it out to anybody on the street? If the answer is no, then you probably should do something about it. And then 2, when we go in and do risk management seminars and you know, training with our clients, and we talk to everybody about treating every patient as a potential reviewer, right? So along the continuum of care, through that whole process, from the person that's checking you in to walking you back to the physician, you know, every person in that continuum of care will be reviewed. So that's kind of a critical piece to that. I guess my question is, you know, how do you guys address, you know, your critics, you know, negative feedback? Do you guys, is that something that should be done online? Is it something that should be done over the phone? You know, how are you guys educating your clients on how to deal with negative feedback?
All right, so we have tools in our software that allow you to respond, like to Google reviews. I think at a minimum, you should respond to Google reviews, and they're not a lot. Like you could go to any practice. You know, I'll show you, like, we have a client, oh, it's on this page here. We have some interesting data here. So this is an orthopedic group's 25 doctors. You can see the number of, these are by quarter, the number of 1-star reviews on Google. And this is typical for, you know, a practice. If you look back and you sort by lowest ratings, you'll see they're very few and far between. And this practice had, you know, and then they started reputation management, and still they get 3 a quarter. Like the 1s, 2s, 3 stars didn't really explode. I think the message there is that if a patient's going to give you a 1-star review on Google, almost like no matter what you could do, they're going to do it anyway, right? Even if you service recover them, do whatever you can. But the strategy is you just want to bury that with hundreds of 5-star reviews, so the 1 stars don't stick out. They're outliers. Outlier, which is another Malcolm Gladwell book, which I highly recommend.
Evan, right now we're just seeing the questions, the practice improvement questions on the screen.
Oh, I see. All right. Let me pull this screen. Do you see it now, the graph? Oh, there it is. Oh, I got it. I'll get it in 2 seconds. Hold on. I don't know why. Oh gosh, all right, I'm gonna try this. Here, oh, I found it. Sorry, it was on another one of my screens here. Let me just pull it over and then share the screen. There we go. 2 seconds. All right, put it right there. Now it'll work. All right, you see. There it is. You see it now, the green bars?
No, I see a verified review page. Mark Steele.
Really?
Maybe stop and start again?
Yeah, stop share. Screen share. How about that? You see the green bars?
Yep, gotcha.
We got it
Okay.
now.
So, right, so this is a practice. They had between 1, 2, 3, 4, 5 one-star reviews every quarter. And then they started with their reputation management activities, and you could see the number of 5-star reviews explode, so also 4, but 1 really stays the same. So even if you start getting more reviews, you're not going to get a lot of those low number of reviews, right? You know, the 1s and the 2s, they'll still stay kind of consistent, and you should respond to those. So if you have, let me pull up the profile here. So if you have on here, there's from our software you could do it. You could go right to Google and respond. And so that's why, like when I'm a patient or a customer and I see a business is engaged and is responding, it takes a lot of the edge off the negative reviews. So I think that's key. Also, as Sam is probably ready to tell you if I didn't say it, one of the factors that Google uses to put you up in this 3-pack. There's the big ones: quality, quantity, recency. So the quality of reviews, highest stars; quantity is the number, and recency is when the last one was put. So they'll give you a higher ranking to get into this 3-pack if the last review is 3 days ago versus 3 months ago. But other things, and there's so much research about this online. Other things are how the practice or the doctor is interacting with the listing. So practices that are engaged with their patient base and are putting comments on, Google gives you extra credit for that and makes that listing more likely to pop up on your local searches, your doctor near me searches. Okay. Any other questions?
I don't see any, Evan. If the attendees want to get a hold of you or Sam, what's the best way to get in touch with you guys if they got questions after this?
Oh, just here, I'll type it right here. It's just info at RATER8, so they could go right here. Just I'll type it right here. Info at RATER8.com. No, just that's an active email box, and we'll get right back to you. Feel free to email, even if you have any other questions or you have Google My Business, some advice. I mean, we should just have a whole webinar on Google My Business. Like we have these consultants that work with these listings 24/7. They're kind of like herding cats. Right? They're, just getting these listings perfected and getting them claimed and owned and getting the pictures to look right. And what you put here, that's another factor that Google looks at, is how many photos are on here? Do I have office hours? Is the address correct? Does the address match perfectly with the address on your website, on the location page on your website? Believe it or not, that's very important in increasing the rankings of these listings. So if you have any Google My Business questions, we're happy to help you. Or if you ever want to, next webinar we have, maybe we'll do that because people are always asking questions about Google My Business. We could provide you information.
Well, Evan, I want to thank you again on behalf of the Healthcare Academy for joining us today. Sam, thank you as well. You guys have been a great wealth of information for us and our attendees today. If you're not familiar with the Healthcare Academy, check us out at wichitahealthcareacademy.com. We got some great events coming out throughout the year. I want to wish everybody a happy and safe 4th of July weekend, and we'll talk to everybody soon. Take care.